Hello, everyone, and thank you for joining today's webinar. My name is Savitri Guretti, and I'm the Public Health Program Manager at the Hepatitis B Foundation. On behalf of the Foundation and CHIPO, I want to thank you for joining today's Speakers Bureau orientation. During our time today, we will provide an overview of the Speakers Bureau and discuss resources, including the Speakers Bureau toolkit. We will talk about preparing for both advocacy interviews and media interactions. We will close with a Q&A session, and I will be presenting today along with Dr. Sherry Cohen. Before we get started, I just want to review a few housekeeping items to let you know how you can participate in today's webinar. Please note that as of right now, all the attendees are in listen-only mode, and you will be muted during the presentations. After all the presentations have been completed, we'll be holding a Q&A discussion session where you can participate in two different ways. First, at the start of the Q&A session, you'll have the option of being unmuted to ask your questions to Sherry Cohen. Or you can also submit your questions by writing in the chat box in the lower left-hand corner of your screen. We will be reviewing them as they come and address them at the end of the session. Please note that today's webinar is being recorded, and you'll receive an email with a link to today's recording after the webinar. Before we get started, I would like to give everyone a chance to introduce themselves. We will be unmuting each participant to give brief introduction. So as I unmute you, please introduce yourself, the organization that you're affiliated with, and the city and state that you work in. I believe you should be unmuted.
Emma, we unmuted you if you want to introduce yourself.
Hello, can you hear me?
Yes.
Oh, excellent. This is MM Martin with the Adventist Healthcare Center for Health Equity and Wellness, based in Gaithersburg, Maryland, just outside of Washington, D.C., and I'm excited to join you today.
Thank you so much for joining.
Thank you.
And I'm not sure if the other person has audio option or if they've logged in using their computer speaker.
Yeah, it looks like you haven't put your PIN in. Sadie, if you put your PIN number, there should be a PIN number on your audio. If you put your PIN number in, we'll be able to unmute you.
It's fine. We can do an introduction with the Q&A session at the end if you do have any questions.
Okay,
so
good.
Now I'd like to turn the meeting over to Sherry Cohen to begin the orientation.
Thank you, Pavitri, and thanks for joining us today. We are going to give a quick overview about the CHIPO'sSpeakers Bureau and hopefully give you an idea of what to expect and how to use the toolkit that we sent out. And we're also going to be posting it on the website. And then in the end, we can talk a little bit about upcoming, there will be three upcoming opportunities in March, April, and May. So hopefully we can talk a little bit about those and see if anyone is interested in signing up or has already signed up for them. The CHIPO'sSpeakers Bureau was developed in order to elevate awareness and to address hepatitis B in African immigrants across the United States. The Speakers Bureau was relatively new, and it was based upon the Hep B United Speakers Bureau, which now has 45 speakers around the United States. And we're hoping that the CHIPO'sSpeakers Bureau will take off in the same way. Speakers are volunteer members of the coalition, as well as community spokespeople who are working in African communities around the United States. The goal is for speakers to disseminate information to improve awareness and hopefully improve awareness in multiple languages. Through the Speakers Bureau, speakers will have the opportunity to participate in advocacy efforts both at the local and the national level. And speakers will also become familiar with how to engage with their local ethnic media outlets, And this will include newspaper and potentially television and radio interviews in order to ensure that we are pushing out accurate information about hepatitis B that can reach high-risk audiences. Speakers Bureau speakers will be promoting hepatitis B awareness, screening, vaccination, and linkage to care, particularly in African communities. And speakers will help promote local and national hepatitis B events and efforts. And because of this, very often what you'll find as a speaker is that speaking opportunities and media events will often happen right before or during national or local events. So for instance, during May Hepatitis Awareness Month, we often will have opportunities to hook up speakers with media, and the same thing around World Hepatitis Day in July. So as a speaker, who will you be talking to? There are two major groups that speakers will be engaging with. One is policymakers and legislators, and the other are media outlets. That would include newspaper, radio, TV, online radio shows, and also potentially creating blogs like Susanna did last year for us. In terms of getting in touch with media, usually media respond when there is something happening or something new to say. So for instance, during World Hepatitis Day, we often get an opportunity to engage with media. So we can push out a press release and media will respond, or we'll push out potential, we can contact media and they will respond to us right around World Hepatitis Day when they know that there's something to talk about and that there are activities happening. But also local awareness events, or if there's something new to say. For instance, if there's a change in guidelines or if something new has been found in terms of research, it's a good time to talk to media. And that will often be times where media is most likely to respond positively. For instance, in Philadelphia, when we have a big screening and education event, we can often get media to talk to us. Or if we have an awareness event. So if we're doing, a couple years ago, we did a flash mob at City Hall, and we were able to get media to come to that. So you, as a speaker, can contact media outlets directly if you know who to contact, or if you are having a local event and you wanted to contact media and don't know how to, that's when you could contact us at CHIPO, and we can help you get in touch with your media representatives if you feel like something newsworthy is happening in your local community. And sometimes media will contact us. So for instance, if we put out a press release for CHIPO during, so Hepatitis on the Hill is happening in the beginning of March. If CHIPO was to put out a press release, media might contact us in response, and then we would put them in touch with you as our speakers to talk to them. In terms of advocacy, mostly we will be partnering with other organizations to coordinate advocacy events. For instance, Hep on the Hill, which is in March, and hopefully you guys have had a chance to, if you can go, you've had a chance to register and maybe even have put in your scholarship applications for that. You will mostly be focusing on the topics within your toolkit, highlighting the most opportune or timely issues, and we're going to talk about that a little bit more. For instance, when we go to advocate on the Hill, we usually focus on things like increased funding for viral hepatitis. So if you are participating in Hep on the Hill, appropriations would be the focus. So when we go in, we're always going to be asking for support, potentially for increased funding for the Centers for Disease Control and Prevention for viral hepatitis specifically, or increased funding to the NIH for viral hepatitis specifically. We're going to talk first about how to engage with policymakers. We do make visits with congressional representatives to advocate for change. We do it locally, and then together we do it nationally. And the idea is for us to help develop relationships and create champions for our cause, which is hepatitis B, and particularly hepatitis B in African immigrant communities in the United States. We need to let our leaders know that hepatitis B is very important to their constituents, and so our job is to inform them. In particular, from CHIPO, we want to let legislators know that hepatitis B disproportionately affects African immigrant communities, who then have increased risk of seeing negative health outcomes, including premature death. And then once we educate our legislators, we want to seek support for something specific. So either we're asking them to support a specific policy, or we might be asking for increased funding for hepatitis B. And in particular, maybe we're asking to include African immigrant communities in a research plan, for example, maybe in NIH's research plan or CDC's research plan. We make visits as a group usually, and we do this to show strength. And we also coordinate our visits to very specific times of year. So for instance, we coordinate Hill visits according to the federal budget cycle, when we know that decisions are being made to try and gain support for increased funding for viral hepatitis. When you go to a Hill visit, you will almost always be in a group, so it's really nice not to have to go in by yourself. And as a beginner, if you've never made a Hill visit before, typically you'll be put into a group with people who have done it before, or at least one person who has done it before. And one person will typically be made the leader of the group. And usually that's a person who has experience making Hill visits and knows their way around. You will almost always receive specific training and talking points before each specific Hill visit, because every Hill visit you might be focusing on something different, and you might have a different ask, and so almost always you'll get specific information and training before every Hill visit. When you go to DC to make Hill visits, usually we try and schedule it so that you make multiple visits in one day, so that you're not traveling to DC to make one visit. I've sometimes gone and made 2 visits in a day. I think the most I've ever done was 6. That was quite a bit. We try and make sure, if we have a group of 5 or 6 people who are making Hill visits, we try and make sure that everyone gets to visit their own representative, because you're their constituent, and so it's very important for them to hear from you. Now, when you go to make Hill visits, you almost always will meet with a staffer. You may not meet with the representative themselves. And the important thing to remember is that meeting with a staff member instead of an actual representative is not a bad thing. The legislative staff, they speak directly into the legislators' ears, and very often they're the ones who are educating their boss about what's important. So it's okay, it's not a bad thing to meet with a staffer. It's a good thing. And you'll notice they will take notes on everything we say, and they will make sure that they bring it back to the legislator. This is just a slide that offers some tips for making Hill visits. I think the most important thing to remember is that advocates play a very big role in the decision-making process at the federal level. We as advocates have to remember that legislators don't necessarily know about our cause. It's up to us to inform and educate them. You going in, you are the expert, and so it's important that you speak authoritatively about the work that you represent and about the federal programs that help you do your work. The people that you're speaking with may have no idea about hepatitis B. They may not know anything about the programs that exist. They probably have never heard of CHIPO. They may not know about your work. So what we need to do is make sure that we can adequately describe the problem of hepatitis B, the people who are most affected by it, and really we're there as a representative of the people who live in the communities that our legislators are elected to represent. When we do go on Hill visits, we do try and meet with our group in advance, even if it's just for 10 minutes before we start our visits. And that is kind of to roll out a strategy so that everyone who's in the group knows what the purpose of the visit is, and everyone knows what their role would be. So if you're going on visits with 5 people, we want to make sure that all 5 people get to speak, that you are able to tell your story, even if it's just for 2 minutes, which is usually what you get. And when you do go in and you're in a Hill visit and you get to tell your story, what you really want to do is make it personal. We have found that personal stories that can highlight the issue really really resonate with people, and really we can go in and spout statistics, which sometimes we have to do, but it's the personal stories and talking about how people are truly affected by hepatitis B. That's what really is going to make a difference for people. So after you go in and you do your visit, what you want to try and do is get a card from the staff people that you meet with, and then send a thank you email, hopefully if you can within 24 hours. And that's important because it lets the staffer know that you're following up, and it also keeps you fresh in their mind. And then they have your email and your contact information. And if you do have a card, it's important to bring it with you. This way people can remember who you are and can contact you. So what are we advocating for? Primarily, we advocate for resources. For example, we advocate for increased funding for the Division of Viral Hepatitis. And sometimes we will coincide our asks with the other people who we're meeting with. So there are people who work on this kind of for a living, and they may say to us, you know, this is the most reasonable ask. This is what we're asking for this year. And so you don't necessarily have to create the asks yourself, and that's really nice because you're given information beforehand about what your ask will be. But almost always we're asking for some kind of funding or resources to help us do our work better. We also advocate for support for the Viral Hepatitis Testing Act, which if none of you have seen, I can send it to you. I can send you a link to it. The Viral Hepatitis Testing Act calls for increased testing for both hepatitis B and hepatitis C, and it also calls for linkage to care. And there is funding associated with the Viral Hepatitis Testing Act. So we do, at certain times of the year, that will be our main ask. Certain times we will focus on funding or something else. We also advocate for support for hepatitis B screening as a preventive service. And then we will often advocate for related services, things like Medicaid expansion in your state, or we've often advocated for harm reduction to increase funding for needle exchange programs to help to reduce the burden of viral hepatitis and reduce the spread of viral hepatitis. And one of the biggest things for CHIPO is to advocate to establish NIRA Day nationwide. We do have some opportunities upcoming at the end of this. After I'm done presenting, hopefully we can talk about whether anyone has opportunity to go to either of these things. Hepatitis on the Hill is March 6th, 7th, and 8th. March 6th and 7th are typically training days, and then March 7th and 8th are days that people make Hill visits. And that's really nice. Last year we had 70 people there. So if you do get an opportunity to go to Hepatitis on the Hill, hopefully either you were able to apply for a scholarship or you can let me know. CHIPO does have some funds to send a couple of people to this. There will also be in mid-March, American Liver Foundation will have a Hill Day, which I will send information out about as soon as I get it. And then in April, AASLD will have their Liver Hill Day, which is another opportunity. I would say also to expect some upcoming dates in May, which is May Hepatitis Awareness Month, and also in July, which is when World Hepatitis Day is. We're now going to switch gears and talk a little bit about how to engage with media. When you're conducting media interviews, it's a little bit different than going in to advocate. Usually you're conducting a one-on-one interview, and very often you won't have a ton of time to talk to the person who's interviewing you. So what I always tell people is it's a good idea to practice in advance what you're going to say. And this is really a nice way to bring in the talking points. So in the toolkit that we put together for you, there's a page that just has talking points. And these are kind of short bullets that are important and that drive home the important points that you might want to focus on during a media interview. What we do at the Hepatitis B Foundation is we practice our talking points in advance. And often we'll do this as a team where we'll all sit around the table and practice our talking points. A nice way to do this is to try and create a few 30-second elevator speeches. If you've never written an elevator speech before, basically the idea is if you walk into an elevator with someone really important to you and you've never met them before, and you have 30 seconds to make your pitch to them, what would you say? And writing down and then practicing 30-second sound bites can be a really good way for you to prepare for a media interview. Going into a media interview, it's important to know what the purpose of the interview is so that you can coordinate your talking points in advance. And you want to know who the audience is in particular, whether it's a general newspaper or it's maybe a radio show that focuses that people are listening to in certain areas of the country or certain areas of the world. Being very clear and concise in your language is important, particularly if you're doing radio or TV spots. Often in radio and TV, it's a very short soundbite that will be picked up. That happens in newspaper too, by the way. So saying things in a very short and concise way can be that can be the thing that you'll see printed. And also with a media interview, it is okay to tell your interviewer that you don't know an answer to something. In fact, it's encouraged. If you really don't know an answer to something, you can say, you know, let me check on that and get back to you, and then you can either shoot them an email or a phone call with a response to something. Next, I wanted to very quickly go over the Speakers Bureau toolkit. This slide just tells you what the contents in the toolkit are, and then we're going to go over each aspect in a little bit more detail. Inside the toolkit, the first thing you see is a one-pager about CHIPO, including a list of our partners. You will also find a hepatitis B and liver cancer fact sheet and a summary of current hepatitis B policy initiatives. And we will make sure that we update the policy initiatives for you as they change. You can find those changes on our website, and we'll email them to you as they come up. To help prepare people for interviews, the toolkit also contains, like I said, short talking points for hepatitis B. And the talking points are an easy way to have facts and information at hand for interviews. To prepare for interviews or visits, you should be familiar with how and why CHIPO was formed, and focus on the fact that we have a national reach and show them that there is power in partnership. So for example, at CHIPO, we have as partners researchers, advocates, nonprofit organizations, health departments, and clinicians. And this kind of multidisciplinary partnership helps to strengthen the group and shows that we have strength in number. Also, you want to make sure that you are aware of the myths surrounding hepatitis B, particularly surrounding hepatitis B transmission and prevention. Believe it or not, this is one of the most common things that comes up during interviews is people will ask facts about hepatitis B that they've heard and look to you either to tell you if it's true or not. So for example, you'll see in the talking points, hepatitis B is not transmitted through casual contact. Sharing family meals with infected individuals is safe. The vaccine is safe and the vaccine is effective in preventing people against hepatitis B. So these are the kinds of myths that you might get asked about. Also, you want to be aware that hepatitis B is often associated with stigma and discrimination. And the best way to overcome stigma and discrimination is to educate the public about hepatitis B. So we know that it is incredibly important for people, particularly people who were born in other countries and people who immigrate to the US and their children. We want to make sure that they are appropriately tested. So that's one of the most important things that you can talk about in a media interview is the fact that African immigrants and their children are at dramatically higher risk for being infected. But unfortunately, only about 25% of people know they have hepatitis B, and that puts people at really great risk of dying prematurely. So we are really promoting and advocating testing. That's the crux of what we do. We want to make sure that every person in the United States who has hepatitis B knows that they have it. Also, before you go into an interview, you can use your toolkit to help you better understand what the current policy issues are facing hepatitis B. One of the most important issues now is the United States Preventive Services Task Force, or USPSTF. So in 2014, they put out screening recommendations, and that the recommendations include screening for people who are at high risk for hepatitis B. So it's important to understand what the implications of those recommendations are. At this point, we want to promote and advocate for the implementation of these guidelines. That means educating legislators, healthcare providers, and other key stakeholders, educating them and making them aware that hepatitis B screening for high-risk individuals is a reimbursable service. One of the other ongoing advocacy issues is the fact that hepatitis B continues to be under-prioritized and underfunded. So we very often advocate for more federal dollars for hepatitis B research and screening programs. There are also resources that we put in the toolkit that you can use to help you learn more about hepatitis B and to help you prepare for interviews. So we did put a one-pager in the toolkit about NIRA Day, the purpose for NIRA Day, and how people can get involved to help for 2016 efforts. NIRA Day is a really important initiative for you to know about, and I know most everyone on the call does. Last year, NIRA Day was very successful, and it reached a lot of people, particularly through social media. However, we really do want it to become a recognized day in the U.S., and that's something that we can all do through helping to advocate either at Hill visits and during media interviews. There are other resources that we put in the toolkit. The CHIPO presentation, links to CHIPO presentations are there if someone needed PowerPoints. We also put in the CDC risk assessment tool, which is a very, very quick and easy way for people to find out if they need to be tested. You can take that with you to events or to interviews or even to a Hill Day. We also try to include as many in-language resources as we could find so that we can try and match languages with the audience that we are talking to. And then we did also put links to some of the No Hep B campaign resources and some of the Hep B United trainings and webinars. So these are just examples of some of the sheets that we put in the toolkit. And you can also see here, this is a media interview with Dr. Howard Koh. He was the former Assistant Secretary for Health. And an example of what it might look like to do a media interview. That is all I have in my components for today. So what we wanted to try and do is open it up to people to ask questions. So I think, Savitri, if you're able to unmute folks, that would be great. And if we're having trouble unmuting people, maybe we can ask them to put their questions into the chat box.
Okay, I've unmuted everyone. But if you have trouble talking, just write your question in the chat box and I'll make sure I address it.
Does anyone have a question? I wanted to quickly see if there is any way that folks can tell me, has anyone who's on the line tried to apply for Hepatitis on the Hill, or is anyone planning on going to Hepatitis on the Hill on March 6th, 7th, and 8th?
Hi, Sherry. This is Emma. I just wanted to give you a compliment. Excellent and thorough job. That's a great overview for anyone who is returning to that type of atmosphere, be it on the Hill or just in media, or just a refresher for us who have had those opportunities before. So thank you very much. I'm not sure that my schedule... Oh, sorry. Go ahead.
No, thank you. Thank you.
No problem. I'm no longer sure that my schedule is open to attend with you all, but I definitely will be there in spirit if I cannot be there in person. So thank you again.
Thank you, Emma.
Sure thing.
Are there any other questions or comments from anyone else who is on the line? Okay. So if there are no other questions, I think that we will end for today. We have been recording this session, so in case you needed a refresher, or if you wanted to use this as a training for some of your staff or volunteers or anyone who might be interested in speaking about hepatitis B and about CHIPO, you can send them the link and they can see the entire broadcast. If anyone else on the phone is interested in attending Hep on the Hill and doesn't know how, please email me, Shari Cohen, at shari.cohen@hepb.org, and I will get you the information you need.
Thank you so much, Sherry, and thank you everyone for joining today's call.